Hey everybody, Jazzmyn Banks here, and today I'd like to talk about joint replacements, some tips and tricks on how to deal with them pre and post surgery. So, as you know from my other videos, I'm having a little bit of a weight gain issue because I had multiple joint replacements, both hips, both knees, and that made me lose 7 inches of my height. As if I wasn't short enough, I went from 5'1" to 4'6", and because my total body mass changed, that meant my caloric intake was supposed to change, and though I wasn't overeating, I've gained weight. I have the weight that I should be if I were still 5'1", someone didn't tell my body. So I wanted to share a few other things to do with joint replacements. I was at the Gotham Comedy Club tonight seeing one of my favorite comedians, Judy Gold, and when she got on stage she was talking about the fact that she herself had a joint replacement and all the, the fun stuff that she has to deal with because of it. And it got me thinking that, a lot of people go into this surgery knowing a lot but not knowing enough, and some of the stuff that really can make a difference in how you proceed with it. It doesn't mean you shouldn't do it, but knowledge is power, what can I say? So, let's start with length. Yeah, you lose length. You just going to. You may lose a little, you may lose a lot. It depends on the porosity and density of your bones and so many other factors, when they open you up and they're cutting, not to be graphic, but when, they're cutting out the bad stuff, the pieces are going to come with it, and that can depend, how much you're going to lose. So the thing you want to tell your surgeon ahead of time that they're, in most cases, not going to discuss with you is that you want to maintain the same length of your legs or your arm if it's a shoulder or an elbow replacement. This is really important with any joint replacement. First question, am I going to lose any length? Potentially. Can you please make sure that I maintain my existing length? Because they can. There are little metal pieces that they can put on to extend the length if you lose your own natural length. So make sure you're very clear with them about that. Put it in writing. It's a very good idea when you go for surgery, anytime you go for surgery, to send them a fax of, hi, this is what we're doing, and just list all the things that are supposed to happen in the surgery and why you're doing them. Sign it, because it puts them on notice of what you are expecting, what you think is going to happen, and this way they have to follow through on it. The other thing is, if you've already had knee surgery and you're going to go and get what they call revisions, new replacements, you again want to address this issue. If you lost length, maybe you could gain it back. This is possible. I'm going to be going for surgery probably in February, and I did say to them, look, I lost 7 inches, what can we get back? So you can make this request. Now here's how that will work out. It's been a number of years since I had mine, so the worry in this situation is, well, have the muscles contracted in such a way that the length isn't there, or you're not going to gain much? Well, this is the workaround. You need to get a massage therapist that is knowledgeable and skilled in tissue lengthening. Now, I know that sounds painful. Well, I've had it done. It's so not. It actually feels really good. They just grab the muscle in big bulk and they just kind of pull, and then it relaxes, and like chewing gum, it just kind of pulls. You gain length, and it's actually good for the tissues. It's actually a good thing to get done regularly because it brings circulation and oxygen to the muscle. It just kind of causes a separation between the fibers so that you don't get stiff and you're not as flexible. It's actually one of the things that as we all get older, we start to lose flexibility, and we aren't suddenly able to bend in ways that we could before. Well, if you regularly went for tissue lengthening within a massage, you would actually help prevent that to a degree. It's actually a very important thing to do. So a few weeks before your revisions, that is the replacement of the replacements, you want to go and have this done probably 3 times a week. The massage therapist would be able to tell you if you need a little bit more than that, or if 3 times is good. Probably 3 times is the minimum you should have, because for a few days the muscles will hold their new length, and then they're going to shrink back. So you want to maintain it, and you want to do it as close to the surgery as possible. You could start months in advance, but the point is 3 weeks before you have to do it as intensely as possible, regularly as possible. The other thing you want to ask your surgeon is what kind of knee replacement or joint replacement, whatever it is that you're going to get. Specifically talking about knees, you want to make sure that the knee that they're going to put in you functions as close to a normal knee as possible, because some models, usually older ones, do not bend all the way. Now this doesn't sound like a big deal until someone bangs into you, until maybe you almost fall, and the knee moves past the position where it would stop. Because what will happen is it has to compensate. And what I experienced is that it shattered my thigh bone, because the metal rod that goes into your bone had to go somewhere because the knee could not bend. So this is really important to find out what kind are you getting, and it's better not to get that kind. There has to be a really good medical reason why you need that kind. So that's an important thing to remember. And also just to ask the doctor, what are the limitations of the knee? As good as it's going to be, there's still going to be limitations. Don't think there won't be. And what do you need to be aware of so you know how to safeguard yourself and not get injured, not compromise the knee. Also, and how long is it going to last? On average, they last 15 years if you do average activity. Because I don't walk, in theory, they should last longer. If you're walking, 15 years. If you are running or dancing, it could be less than that. And so this is very important to take into account what kind of activity do you plan to do, and find out what knee replacement is going to best suit your lifestyle. Now the last part that I want to talk about is something, again, that they sort of talk about, but not in the detail that you need to know. And that is scar tissue, which can be a big deal. You think weeds on your lawn are a problem? Scar tissue is like the weed of the body. Once you slice into all those tissues, your body freaks out, and it goes, oh my God, we got to repair this, we got to grow something to repair this. So it makes a cement, basically, known as scar tissue, which sort of heals everything together, but it's not the best kind of tissue to have. It's really hard, and it's not as flexible, and it tends to suddenly grow, and it can grow in between and wrap around. It can strangle stuff. So depending on what kind of surgery you have, it can cause some very big problems. I had a friend years ago that had her appendix removed, and the scar tissue from the appendectomy grew and wrapped around her uterus and her fallopian tubes. She wasn't getting pregnant. She couldn't figure out why. When they were examining her and they felt all these lumps, they thought, oh my God, you have cancer. And when they went in to do exploratory surgery, they found this garden of scar tissue entwined through everything, which sounds like, okay, what's the big deal there? Okay, they got it. No, the big deal, aside from she couldn't get pregnant, was that it was strangling everything, and had they not caught it, it would have set her up for a gangrenous situation, which could have been a septic situation, and she could have gotten an infection and died. She could have also just lost her reproductive system. So it can be very serious. In my case, after my knee surgery, my right knee got stuck straight. I mean, literally straight. Couldn't bend it. The strongest of people couldn't bend my knee, because the scar tissue, when they reopened me, had woven between everything. I mean, they had to take everything apart. They had to remove muscles, put them to the side, and just get in there and get all this tissue that had just gone every place it could ever dream of. So the way to avoid that is they're going to teach you, or they should teach you, scar tissue massage. You can Google it. They show it on, there's plenty of YouTube videos on that. That you do every single day, preferably a few times a day, on the scar tissue, and also just massaging the general area and deeply massaging it to, as far as you can tolerate, and even push past that a little bit. Because aside from preventing it from growing further, is what, part of the goal is with the massage, the other thing is you're breaking it up. That's part of how it prevents it. It's part of how you're fixing it. It's a twofold thing. So this is going to be incredibly important to do, because otherwise the end result is going to be surgery. So you want to make sure that you find out from the doctor how you're going to do this, what's the physical therapy plan afterwards, and you want to make sure that your physical therapist that follows up with you is pro massage therapy. They do learn it. Not all of them believe in it. You want to make sure the one you get believes in it, because that's actually almost more important to do for this kind of surgery than even just the exercises and the stretching. The massage will help the process along. And also that tissue lengthening that I spoke about would be incredibly helpful afterwards as well, because again, you want those tissues to get circulation, you want them to get movement, you want to break up any crystallization, and also just the flexibility is incredibly important, especially after a surgery like that. So if you have any questions or comments about joint replacements and the things that you're worried about for yourself or anyone that you know, or any questions about things that I've spoken about, I'd love to hear from you. And remember, yes, there are concerns with any surgery, but this one, as long as you find out from the doctor, from a physical therapist, just ask around what are the things you need to think about. Just preventive medicine is really what this is all about. Just know what you need to do to prepare yourself to have the perfect outcome with the whole thing. And you can have, a happy life being bionic. Trust me, it's awesome. Thank you very much, and I look forward to talking to you guys again soon.